How's it going? I am Dr. Jordan, one of the chiropractors here at Advanced Spine Joint and Wellness Center in Medina, and I just want to take a minute to talk to everybody about kind of what you can expect with our first visit in our clinic. Now, the biggest thing is figuring out what's going on with you, and what that involves is a thorough orthopedic exam as well as x-rays. Now, both of these things can give us a lot of information that we can use to really figure out what is going on, what is your diagnosis. Once we have a diagnosis covered, that is when we can accurately and thoroughly treat the issue. But if we're going in blind or just kind of guessing on what's going on, treatment doesn't tend to stick too well. So we really want to have a good understanding of what's going on with you, what the issue is, and where do we need to focus. Now, I just want to give everybody an example of things that we look for on these x-rays that help direct our treatment. Now, when we're working with the lower back or the neck, the first thing that we're always going to look for is alignment. In your lower back, we are going to look at your pelvis. So your pelvis should ideally be level. Now, through life, through working, through different people's jobs, repetitive motions, a lot of different things can alter our alignment. And when we see hips or pelvis that are out of alignment, we can measure those just to see how severe or mild it might be. Now, normal limits, it's normal to have a pelvis out of alignment within 0 to 5 millimeters, but when we start getting beyond 10 millimeters out of alignment to 16 to 20, we start realizing we have an issue. And what that causes is our body weight might be distributed unevenly, or more weight sits on one side. That then starts compressing discs and causing pinched nerves. So if we always only attack the pinched nerve but never address the underlying issue, we might have recurrent problems that just keep coming back. That's why it's important to get these x-rays taken, to do the exam, to really figure out and understand what's causing the issue and where the issue is at. The other thing that we look for on the x-rays is we want to see how the disc health is, how the bone health is. Now, ideally, we want to see good curvature through the spine. We don't want to see too much arthritis. We want to see nice, square vertebrae, no jagged edges. And then finally, we want to make sure that your discs, so those cushions in between each level of the spine, are all the same height, all the same shape. They're kind of like car tires. They should all have the same amount of wear on them. Now, sometimes when we get out of alignment, we wear some of the tread off the tire, and that is what this looks like. We can see a loss of disc space, or the lack of disc space, which is causing compression or pinching of the nerve. And now we really know where to focus our efforts to get you feeling better. This is just one of the ways that we can really figure out what's going on with you to effectively treat your condition and get you some good relief. If you have any questions or concerns, please reach out, let us know, really see if we can help you out. Thanks for listening.